Hi, everybody. It's Adam with HeartValveSurgery.com. And today we're answering your questions all about what patients can expect in the hospital. I'm thrilled to be joined by Dr. Patrick McCarthy, who is the Chief of Cardiac Surgery at Northwestern Medicine in Chicago, Illinois. During his extraordinary career, Dr. McCarthy has performed over 10,000 cardiac procedures, of which more than 6,000 involve some form of heart valve repair or heart valve replacement. Dr. McCarthy, as always, it is great to see you again, and thanks so much for being with us today.
Thanks, Adam. Always a pleasure to talk to you and be here with HeartValveSurgery.com.
Yeah, and so, Dr. McCarthy, let's answer a question that I get 3 to 4 times a week. I imagine you get it all the time when you're seeing patients, which is, how long will a heart valve patient be in the hospital?
That's a great question, Adam. And literally, I answer that one every day. And it's something important. Your patients should really ask their doctor beforehand, because I can't answer it until I'm sitting there talking to the patient. It depends on how old they are, how complex the operation is, and so on. I'll give you a sense of the national data. If someone is undergoing an aortic valve replacement, pretty straightforward. They may expect about 6 days in the hospital. And if they're undergoing a mitral valve repair, they might expect about 5 days. Now, that can vary a lot depending on the level of complexity of the surgery and the overall condition of the patient.
Dr. McCarthy, I've got to ask, how has that changed during your career?
Adam, I can't tell you how much it's evolved. It's so remarkable where we are in 2022 compared to way back in 1980 when I began as a young intern. Back in those days, patients would frequently be in for about 10 or 14 days. The breathing tube would stay in overnight in every single patient, even the most simple patient. So we have evolved and improved things so much. And I didn't mention it, but even there's a lot of our fast track patients go home day 3 these days. So it's just remarkably better.
Dr. McCarthy, are there any medical advances that have shortened the stay of patients in the hospital?
Really, things have evolved, especially with transcatheter approaches. So transcatheter aortic valve replacement, or TAVR, a lot of those patients are going home the day after the procedure or maybe 2 days later. And many of those are being put in patients that are kind of elderly and frail. And so those are the patients that in the past we would have expected to have to stay in the hospital a long time. Furthermore, not just are they going home, but they're going home, not just out of the hospital, but home. And in the old days, just to recover from open heart surgery, many of those patients might have to go to skilled nursing or some such facility. And now we're also seeing it happen with mitral valve surgery, with MitraClip and Pascal, and the transcatheter treatments for mitral and tricuspid disease. So again, it's been sort of remarkable, the amount of improvement that we have been seeing.
Dr. McCarthy, I also get questions about comfortability of patients in the hospital. Is there anything that you and your team at Northwestern Medicine are doing to help patients be more comfortable?
Really, we focus a lot on patient comfort. And I think that's been sort of the secret sauce and part of the reason that patients are going home early. If you think of the transcatheter approaches, well, they don't really have an incision. And so patients can recover quicker without pain and then go home earlier without pain. But we're doing things like nerve blocks in the operating room before the patient has really even woken up, so that they wake up and they don't have much pain. On a scale up to 10, where 10 is the worst pain you've ever had, many of my patients say the first day is kind of the hardest, it's a 3 or 4. But by day, the next day, it's more like a 2. And so we're very focused on reducing the patient's pain and making them more comfortable. And the other is we try to avoid narcotics when they're not having a lot of pain and they don't need narcotics. That makes a difference, because the narcotics cause them to be drowsy and it makes them difficult for them to recover.
Dr. McCarthy, I love hearing about the comfortability that you and your team at Northwestern Medicine are providing for patients. I'm curious to know if you're going to answer a question that I get all the time, which is, what should I expect while I'm in the hospital?
That's a great question, Adam. And just to kind of sketch it out for them in a typical patient, these days we remove the breathing tube in the operating room in most of the patients with heart valve surgery, so they don't even remember it. Otherwise, shortly after they arrive in the intensive care unit, and again, they usually don't remember it. Oftentimes that night, they may already be out of bed, sitting in a chair. The next morning, at least they're sitting in a chair and walking. The chest tubes come out, which is another big step forward because some people have discomfort from the chest tube. And then typically that day, they go up to a regular nursing floor, and then it becomes walking in the hallway. And then they get tested going up and down stairs with physical therapy, and they just get stronger, and they get their medicines adjusted. And then it's time to give them their discharge instructions, and it's time to go home.
Dr. McCarthy, another question I get is, what should I bring to the hospital?
Adam, people ask about what they bring to the hospital, and usually Janice, my nurse, is the one that goes over a lot of that with them. I can tell you what they sometimes forget, though, which is their phone and their charger, especially the charger. And so they need to be reminded about that. Some people have CPAP for sleep apnea, and they have their own personalized mask. And so that's a good thing to do. Obviously, we have toiletries, and most people will bring a robe too. Hospital gowns are not designed for fashion.
Dr. McCarthy, another question I get about the hospital is, can my care partner, maybe it's my spouse or my son or my daughter, stay with me in the hospital?
Adam, it depends on what hospital they're in, but I don't know that any hospitals allow them to stay in the intensive care unit. I don't recall ever seeing or hearing of that. But once they leave the intensive care unit, so for instance, here at Northwestern, we actually have a couch that folds out, and so their care partner can stay with them. Obviously, all of those rules evolved through the pandemic, although fortunately, those have become much looser, and so visiting hours are returning to normal.
Dr. McCarthy, given all the patients that you've helped over the years, what else should patients think about when they're getting ready to come to the hospital for surgery?
Adam, I think we covered all of the high points. I think the thing that patients should understand is that in many times, the hospitalization is not nearly what they thought that it was going to be, that it's a lot smoother, and that they're not having as much pain as they may have heard from someone who went through an operation, 30 years ago or something. So that a lot of the information that is out there is not necessarily accurate. So it's just been a really remarkable and gratifying evolution to see how much easier this is on our patients, and to have them be able to recover and go home and act like, that wasn't so bad.
Dr. McCarthy, as always, thanks so much for sharing these insights with the patient community at HeartValveSurgery.com. Just want to extend a huge thank you to you and the entire team at Northwestern Medicine in Chicago for being so supportive of our community over the years. Thanks again.
Thanks, Adam, and thanks for all that you do for the patients and for the community. There's so many hundreds of thousands of patients now that you have educated with your reach. It really is. We're just so happy to see that you've been able to bring people some really accurate information. Thank you.
Hi, everybody, it's Adam. I hope you enjoyed that video. And don't forget, you can always subscribe to our YouTube channel, watch the next 2 educational videos coming up on your screen, or click the blue button to visit HeartValveSurgery.com.